Hello, I'm Elizabeth Duke, the Administrator of the Health Resources and Services Administration. And I'm here to spend some time with you talking about one of the most important missions in this agency, namely ensuring that we have healthcare providers where we need them, when we need them, well qualified, diversified. A quality healthcare system depends on having a really superb healthcare provider system in place. You are they, you're the key. Everything you do builds the quality of this healthcare system.
What if you could change just one life? What if you could make a difference? Would you do it? What if we could work together and make this world just a little bit better for everyone? One by one, we're singing. We're singing together to make a difference. The most amazing things we know can all be done through the power of one.
Hi, I'm Marcia Brand. The Bureau of Health Professions has a magnificent mission to improve the health care of the nation by providing national leadership in the area of the health workforce. We do this through grants and scholarships, demonstrations, workforce analysis. We try to ensure the safety of our system and the quality of our providers. And we do this in concert with you, our partners.
The largest challenge facing the health profession today is actually the shortage of them. In general, physicians and nurses. What we do is collect data from the grantees that encourage them to actually train in more underserved areas and to provide better quality care. We recently published the Physicians Workforce Supply and Demand Predictions to 2020. We published a national health workforce research study on community health workers that's making a huge impact on the field. Right now, policymakers are making decisions that are helping to make that particular workforce more sustainable.
We've all seen the graphs and figures that point to a crisis in our healthcare system, a crisis that results from a number of contributing factors. Much of our national focus up until now has been on cost. But there is increasing recognition of the need to invest in our healthcare workforce.
There are only 10,227 doctors in Maryland seeing patients on a regular basis, and it's getting more critical.
There are looming provider shortages. There are inefficiencies that result from having the wrong mix of specialty and primary care providers.
In terms of the BHPr grantees, I know it's been a frustration for years trying to find out which areas are designated and where do your graduates work and are they in an underserved area? Are your training programs located in underserved areas? We know that's an issue and has been for a number of years. Well, the fact that we have the online system actually implemented for primary care, and all but I think half a dozen states are using it now. And certainly the majority of them have found it very helpful. The other priorities that we have are trying to finalize a new method for primary care, which will take into account the role of nurse practitioners and physician assistants and a number of other issues that we think will improve the tools that we have and also streamline the process and allow us to be proactive as opposed to waiting for somebody to request an area. We can identify them using national data.
There are also challenges of training or retraining healthcare providers to work in new settings with new technologies. And then there are the challenges of our nation's demographics, best evidenced by those baby boomers who are aging, living longer, and placing higher demands on the healthcare system.
As the baby boomers are aging, the nursing profession is faced with an aging nurse faculty and an aging registered nurse workforce. In 2004, the National Sample Survey of Registered Nurses reported that the average age of a registered nurse was 46.8 years. Of those surveyed, approximately 41% were over the age of 50, and only 8% were less than 30 years of age.
Mama, mira. Cuando mami te dé algo de comer, tú tienes que comer aunque sea un poquito.
The demographics of the U.S. population are changing and becoming more diverse. As a result, registered nurses must become knowledgeable in the area of cultural competence in order to provide high-quality, culturally competent care to all individuals. In addition, registered nurses are spending less time at the bedside and are spending more time in a variety of alternative roles within the healthcare system.
What if I could plant one seed into a field and watch it yield a crop? What if I could change the way the river flows by adding just one drop? Would I do it? Oh, would I do it? Then I remember the most amazing things I've known have all been done through the power of one.
We teach folks how to work with the other providers that are like them. And we go to nursing school and we get socialized as nurses, and we even sit with the nursing students when we go to the cafeteria. But when we practice, we need to be able to work with all the disciplines effectively. So I think that's a challenge to incorporate that into the curriculum.
Well, basically the priorities for our division are to make sure that we have a healthcare workforce in the future that meets the needs of the population. Basically, we want to make sure that students have an opportunity to be aware of the various health professions that exist, that they are able and ready to pursue those health careers through academic development and preparation, that they get a chance to enter the health professions arena because they're competitive in terms of their academics, and that when they come out of the health profession school, that they have the right skill mix, such as they're culturally competent, and they have had experience in disadvantaged populations in underserved areas of our country.
We want to feel confident that everyone who takes our health information, performs a test, makes a diagnosis, provides a service, is well trained and working in close collaboration with our other providers. We want everyone we encounter, everyone who wears a name tag, be someone we can trust.
The primary intent of HRSA's National Practitioner Data Bank and Healthcare Integrity and Protection Data Bank is to protect the public, improve the quality of healthcare, and deter fraud and abuse in the healthcare system. A tool used by a growing number of healthcare entities to monitor and retrieve information from the data banks is called the Proactive Disclosure Service. Launched in 2007, the PDS provides healthcare entities such as hospitals, managed care organizations, and federal and state agencies with an alternate method to generating an initial query or update information on a practitioner that they want to hire or that they may already employ. The data banks has been able to reduce its delivery of a query response from anywhere from 3 to 4 weeks to under 30 minutes. And in the case of PDS, we now can deliver a query response to an entity within 24 hours of data bank receipt.
Our graduates from our training grant programs are 2 to 3 times more likely to practice in underserved areas than non-grantee graduates. In terms of minority student participation, we have 2 to 3 times more minorities in our training grant programs. And we have tremendous accomplishments in our faculty research development programs. Children's Hospital GME has not only sustained the pediatric subspecialty training, but they have provided care, high quality care, to children regardless of income or ability to pay.
At the end of the day, it is really very simple. We want to know that when we need our healthcare system, it will be there for us, and that our healthcare workers are well qualified to give us the best care possible. When you think about it, this is a pretty magnificent mission, and I'm proud to share it with all of you.